Hello. Hello. I think that Puritapa has some technical difficulties. Puritapa, can you hear us? I think that Appa has some problems, so she can hear us. Hello. Puritapa, can you hear us? Okay. I think that there is some difficulties from the Puritapa side. I will be here her later. So now I would like to request our next presenter to continue his presentation, and when the Puridapa will be come back, that we can hear from the Puridapa. Now I would like to request Mr. Sorry, she is back. Can I just allow 1 minute? Just let she just okay. She's back.
Can you hear me?
Yeah, Appa. Yeah, you can.
Okay,
Touch.
sorry. Our internet connection is not very good. So what I wanted to say, that we know that in South Asia, the consumption of smokeless tobacco is very high. But in Bangladesh also, it is highest also, because among the 35.3% tobacco users, smokeless tobacco use is actually among 20.6% of the adults. So, and women are using it most and more than men. And in fact, there are about 22 million smokeless users in Bangladesh. And Zarda and Shadapata users are about 20 million. And
can you share your Abba, excuse me, can you share your slide? We are not, the slide is not. Please share your screen.
But I can see that.
Yeah, that's good.
You can see now?
Yeah, it's visible.
So the number of Zarda and Shadapata users are about 20 million of adults, and these are mostly women. And Gul, which is like a powdered thing which you put on the teeth, is also 3.9 million. So now I would like to say, we don't basically talk about it very much, about the leaf with which the Zarda and Gul is produced. And this is the Motihari tobacco, Nicotiana rustica, and it is cultivated for its chewing quality, and it's said that it has high nicotine content. It's mostly grown in the North Bengal side of Bangladesh along the Tista River banks, and some in other districts. About 19,960 acres of land, almost 17% of the land under tobacco cultivation is used for Motihari cultivation, and 12,177 metric tons, which is about 14% of total tobacco leaf production. And you can see in this picture that these are the like roots and the stem which are kept to make the gul. And this is used for zarda. And you can, these are the they are cultivating here, and then they bring it here on the this is like on the river bank, and they put one every leaf on the ground and have to dry it. This is sun dried. You can see that the women are using, and she is actually the whole day from the very early morning till the sun setting, they have to uh, keep on, looking at the leaves and to put it as sun for sun drying, and this has to be done very carefully, otherwise the quality will not be very good. Some are dried on the by hanging, but it's not very much. It's mostly done on the ground, and children during that season are not able to go to school because the families cannot manage to do it alone, and they need the children to help them. So we found that during that time the school attendance by the children goes very low. So now about zarda and gul production in factories, I put this under quote and unquote because by what we mean as factories, this do not mean that, because they do not have any signboards, there is no address written, or if there is no proper way to get in, they will say no, there is nothing like that. The only way you can find them is by the smell of the tobacco, and that's how you can trace the factories. And inside, if you manage to go there, it's very unhealthy conditions. Women are unprotected, and they have to really, even children are there. So during 2013, we tried to find out zarda factories and gul factories in 38 districts with our Tabinaj members. And we found that actually they are depending on the casual laborers, mostly women and children. Men are also there for some of the work, and wages are very low compared to other work. It's like taka 150 to 250 the most per day, and they also do not have enough work for the whole month. So it's like 7 to 10 days for a family, for the person who is working. And children get even very less, but they are doing the same level of work as the adults. So it's not an employment generating sector as the tobacco industry or this, tobacco growers will argue. Rather, it is labor exploiting, and also they have very unsafe conditions of work. So there is no way that it can be kept. And so now we would also like to see that what is there in Jordan. But we know that the tobacco leaf is there, but we collected all these ingredients by looking at from the tobacco, the Zarda, packet, so they have very small letters, in very small letters, as they have to disclose the ingredients. So we found that there is glycerin, there is paraffin oil, menthol, saccharin, and also there are many leaves and dry fruits like joytun, and these are there. And also, um, according to FCTC Article 9, you cannot put anything as an additive in these products, and also to make it attractive. They basically use it to make it attractive with perfumes, so that when you have pan, other people are attracted by its smell. And gul also, you can see that it has these ingredients, and it has the ashes and stone lime, peppermint, um, and it's there. And also the interesting part is that gul um, uh, packets, when they make it, it's used by used plastics, and it's very harmful, and yeah, they have really very bad consequences. So now I want to show you, the great varieties of packaging or the size. Tabinaj has collected 371 brands of Zarda produced by different small and big tobacco companies and 18 brands of Gul. And and then in the, there are like big size, small size, and we try to look at them, how they differ. We found 46 different sizes, from small to big. And so with weight also, we found 15 different weight levels, starting from 10 gram to 25 gram, even can go up to 150 gram. There is no regulation or any monitoring of how they are doing with these sizes for price gain or for popularity, whatever it is. And price also we found very arbitrary. It can be with a weight of 5 gram to 10 gram. It can be sold at 12 taka to 20 taka, and it can the weight of 12 gram to 25 gram is sold at 15 taka to taka 50. And so also with like weight of 30 to 75 gram, it is sold at 30 to taka 85. So sometimes, it gets mixed up with different kind of weight and sizes. And so it is up to the producer who decides about the price. There is no regulation on its price and shapes. And so this also makes it difficult for use of the law, because for the graphical health warning, and I think TCRC has done a very good work on this, that if you want to really put according to the size of the law, then these packets have being so different in size and so different, small, and they can't really be used properly, so they cannot really warn the users. So, and I want to say that uh, the another before I come to the point of the strategy paper, I wanted to say that in the cultivation of Motihari leaf, it seems apparently like British American Tobacco Company is not there, or Japan Tobacco is not there. We don't see these big companies for Motihari tobacco, but interestingly, there is some very unknown but foreign companies like Zoma Tobacco Company Limited. It supplies, um, in fact, exports from Bangladesh to many European countries for their smokeless tobacco products. So we cannot trace very much about them because very little information is available. But whatever we got, we found that they, there is apparently no company involvement, nothing is there. But these international companies are very much there for international use of smokeless tobacco. So that is something we need to take into consideration. And the finally on the strategy paper, um, the one of the things we did in 2019, that we talked with the government Ministry of Health and Family Welfare, and as the law is very limited to control its production, and we need to have some standardized packaging, and some regulation over the pricing. So the strategy paper was very useful. It was done by involvement of different ministries and different people. So it talks about production control, ingredients regulation. So whatever, you cannot just put anything in the zarda, so there will be regulation on that. It talks about hygienic manufacturing practices and particularly banning of child labor. So if it has to disclose if it had child labor in it, that product cannot be sold in the market. And standardized packaging, which is a very important task that we have now taken up for this year. So what would be a standard packaging size that would be useful for control and supply and sale? And there is no production date, no expiry date is there. So, so we are actually we are talking with the BSTI, Minister of Industries, Minister of Commerce, and NBR, National Board of Revenue, cannot even collect good amount of revenue because the factories cannot be traced, the production is not known, so they don't know who to impose tax on what to impose tax on. And on Minister of Agriculture particularly, because the cultivation is affecting food production very much. Finally, I want to particularly with Ashish Pandey and also Tara Bhai, we in the South Asia, we also need a country-based policy, but also a South Asian strategy for a smokeless tobacco regulation, which should be on cultivation, production, sale, and use. And we have to acknowledge the fact that it is more than smoking, affecting more people, particularly women, silently. So we cannot ignore it. Thank you very much.
Thank you very much for the you covered all the
Tahin,
things.
I want to add one thing after hearing Ashish Pandey, that in COVID situation, we actually checked, how people wearing, especially women wearing masks, whether they are using pan. So we found that when they use pan, they don't wear mask, and if they wear mask, they can use pan. So the some kind of regulation, we have to talk about it. And also there has been less use of pan during the lockdown because the supply was less. So this is one of our findings recently. Thank you.
Thank you for thank you very much. You covered all the things from the production, manufacturers, export, and the labor institution. Thank you very much. It's widely thing. So now I would like to request Ms. Dr. Tara Singh Bam. Dr. Tara Singh Bam, as a public health practitioner, is now working as a deputy director for the Union Southeast Asia Asia Pacific region. He has a long experience. He will share experience from Nepal, Indonesia, and Myanmar. Is working with so many countries, but especially he's now today going to share with the three countries because the three countries has a similar experience like the Bangladesh and India. Now, please, Dr. Tara Singh.
Thank you, Tain Bhai, for giving me this opportunity. The distinguished all the participants, honorable member of parliaments. Again, nice to meet you, sir, the moderator and panelist. As I mentioned the earlier, this is a really great opportunity for me to meet you all online and also share some lesson learned, whatever we have from Nepal, Indonesia, and Myanmar. And since we are facing a global health crisis on COVID-19, so we have to mitigate the impact of COVID-19, and at the same time we have to also cut the chain of transmission of the infection in our community. So I think the earlier presenters already discussed the relation of the COVID-19 with tobacco and smoking, and we know the evidence suggests that the smokers are at higher risk of serious illness and complication if they get the COVID-19. Similarly, there are several evidence also produced by the several researchers, and according to the Council of Medical Research, the smokeless tobacco products increase the production of saliva, that we also know, followed by a very strong the urge to spit. So yeah, we know, working in this area for a long time, tobacco spit creates environmental pollution and is a public health hazard that contributes in spreading the communicable disease, for example, tuberculosis or pneumonia, for this case, the COVID-19. So the smokeless tobacco use is known to have become increasingly popular in our region for last the few decades, and we know that this poses serious health threat, both not only the health side but also economic the side as well. So prevalence. Can you go my next slide, please? Uh, Prevalence of smokeless tobacco among male in Myanmar significantly high at 62.2. No, the previous, yeah, that's right. 62.2%. You can see in my this slide, as compared to smoking prevalence of 35% only. But again, that is both the tobacco smoking and also the smokeless is a big problem in Myanmar context. Among the females, the smokeless tobacco prevalence is over 24%, and smoking is about 6%. In total, over 43% of people use smokeless tobacco and 20% smoke tobacco in Myanmar. So from these statistics, you can see the problem and the burden of the smokeless tobacco in the context of Myanmar. In Nepal, there are 1/3 of males use smokeless tobacco products, and over a quarter of males smoke tobacco. Both smoking and smokeless tobacco is quite prevalent among females, and it is increasing in trend. Overall, 18.3% of adult Nepalese use smokeless tobacco, and 17.1% use smoking tobacco products. So that is that gives some the overview and comparison of the burden of smokeless tobacco and the smoking form. In Indonesia, the prevalence of smokeless tobacco product among female is high at 4.8% compared to males at 3.9%. But we noticed the use of smokeless tobacco product is getting popular in Indonesia. In Indonesia, especially in the eastern part of Indonesia. So tobacco use is the major public health challenge in Indonesia, where 76% of adults males and 39% of general population smoke tobacco. So industry marketing, including electronic cigarettes and heated tobacco product, is really rampant now in Indonesia. Despite the new tools and techniques available for tobacco control, tobacco kills over 27,000 people in Nepal, over 65,000 people in Myanmar, and over 225,000 people in Indonesia. So at least 14.9% of the total death in Nepal, about 17% of total death in Myanmar, and about 15% of total death in Indonesia can be prevented with a strong tobacco control measures if they are implemented. Let me present controlling measures and quickly some challenges and opportunities in my next slide. Next slide, Tanmay. And this slide presents the tobacco the policy, including the legislations and regulation regarding the smokeless tobacco. So as we know, tobacco tax is one of the most effective strategy in tobacco control. So we know there is very little the tobacco tax on these products. While all governments do tax tobacco products, this is limited by the fact that there is no the unified taxation across the tobacco products that there is that we know, and that is also one of the major the challenge for all of us. And this implies that the price of the smokeless tobacco remain low compared to the cigarettes. Even is the price for the smokeless tobacco is significantly less compared to BD and the similar products. So in Myanmar, there is only 20% tax on betel quid with tobacco. This is the chewing tobacco or smokeless tobacco. In Nepal, the tax for smokeless is very low. The recently government imposes health risks tax on smokeless tobacco products with the Nepalese rupees 40 per kilogram. This is really very low. In Indonesia, tax for smokeless tobacco ranges from 11 to 18%. So we know lower tax on smokeless tobacco products promotes switching of consumers from smoking forms of tobacco to smokeless form. So smokeless tobacco is the cheapest product and the one most used by the low-income population. So that is really visible and that we can see in our community. In Indonesia, tobacco smoking, as I mentioned earlier, is the major problem. The current rules and regulations are very much targeted toward tobacco control, the smoking farms. Therefore, there is no such a very good policy to ban smokeless tobacco. However, since marketing of smokeless tobacco is growing, both national and sub-national governments should pay seriously some attention. They have to take serious measures to ban smokeless tobacco product as well. So in Nepal and Myanmar, the smokeless tobacco products also is a big problem. So the both governments, they are, in both countries, there are good tobacco control regulation, including the regulation regarding smokeless tobacco. So the current tobacco control law in both countries that bans the use of the smokeless tobacco products in all public places, workplaces, and public transport. And this regulation also bans the tobacco advertising, promotion, and sponsorship, and also the bans the sales to minors, ban the smokeless tobacco within 100 meters of educational facilities. But in Nepal, it also applies to health facilities. So mandatory pictorial health warning on the pack of smokeless tobacco. For example, you can see that in Nepal is a 90%, and for the Myanmar context, it is only 75%. But in Indonesia, there is no such provision for the smokeless tobacco products. However, these policies are neither comprehensive, that is a fact, nor they are well enforced or implemented in any countries like in Nepal, Myanmar, or in Indonesia. So from Nepal, just I would like to present one examples of industry manipulation and tactics to disobey the government's regulation, ban distribution and sale of alcohol and tobacco products during this COVID-19 pandemics and lockdown. On 24th of May, Nepal police seized 50 sacks that is worth of around 18 lakh the Nepalese rupees, approximately it is 18,000 US dollar of a smokeless tobacco product. The truck was going from eastern Nepal, from Kathmandu, during this COVID-19 period. So the brand's names of the smokeless tobacco was Pan Prag of the product of Pan Prag India Limited, and Rajnigan of the Rajnigan Factory India. So the packaging, the interesting thing here is the packaging of the seized tobacco products was labeled as essential medicines. Can you imagine? It's labeled as an essential medicine. So this is one of the perfect example how multinational tobacco industry markets their products and makes the profit by selling the killer product even during the COVID-19 pandemic. So it means the industries, they are never in favor of public health or even in any the emergencies or any pandemics or any crisis. They always try to make the money. I think that is that is happening at the moment in many countries. So now it is a time to ask the question to ourselves: why don't we have a comprehensive tobacco control law and regulation in our country, in our region, in our settings? Why tobacco products are very cheap in our country? Why do thousands and millions of people die from tobacco each year? And the most interesting thing is for almost for that, yeah, I'm repeating the same things. I think you do the same thing. Why do we repeat the same statistic, even the worst statistic in our presentation over and over for almost 2 decades or even more? So that is something we have to find out the answer collectively. We know to answer this question is not that easy, but we could say because of the tobacco industry, maybe this is somehow relevant or correct. But I would say the answer is the lack of government's accountability and transparency. If governments are accountable, if government's officials are responsible to protect the health of their people, and if the governments and government officials are fully implements Article 5.3 of the World Health Organization Framework Convention on Tobacco Control, I'm sure there would be or will be full implementation of WHO FCTC or any national or subnational rules and regulation in our settings, and we would have protected millions of lives. And definitely if these rules and regulations, everything's implemented, will save millions of lives. So in conclusion, I would like to say political leaderships and accountabilities are the key to address the pandemic. The tobacco pandemic here, the COVID-19 pandemics, and there are many other pandemics currently we are facing. So the political leadership is critical, both at national and subnational level, and especially subnational political leadership is a unique opportunity to build stronger political commitments, establishment of new partnerships, sustainable and effective utilization of local resources, and to make the effective implementation of tobacco control and to achieve, of course, a good health outcomes. So we have the, I'm sure through this the webinar, we have several the stakeholders connected here, and it's our honor to have also the member of parliament in this webinar. So I would say tobacco control is not a choice at all. So it is a mandatory for the governments, for the politicians. So like a mayors, member of parliaments, governments must be accountable to prevent tobacco pandemics by improving existing tobacco control laws and regulation, by making comprehensive implementation of tobacco control, by increasing tax and prices of tobacco products, by completely banning tobacco industry donation, partnership, and interferences. I think this is really, really needed. The only solution is where the governments, the accountability. If governments are serious, if they are committed in action, definitely we will change the whole dynamics of the tobacco, the control. So at last, again, I would like to highlight the whole of government approach is really, really important to isolate and expose the tobacco industries and prevent industry interference, and also prevent the deaths. Those deaths can be really prevented in our settings and also globally. Finally, I would like to say that together we can really beat this deadly the pandemics, tobacco and COVID-19. Thank you, Tahin. Thank you very much. Over to you.
Thank you very much, Bhai. You really, when you share experience, the three country, and if I conclude all the things, it's remaining same. There is no comprehensive law. There is the industry interference. The tax regulation implementation is very low. As the India experience, Bangladesh, almost we are the same. It's a full country. So now, my request to the Dr. Rumana Haq. Rumana Haq is a professor of Department of Economics, Dhaka University, and she has a specialism in health system. She also leading a project, union-funded project on tobacco taxation issue, and they have established a platform. It's called Bangladesh Network for Tobacco Tax Policy. They are working for tobacco tax policy development for a comprehensive for tobacco tax policy in Bangladesh. She also holds the position of the executive director of ARK Foundation. So, Dr. Rumana, please, now floor is yours. Sorry.
Can you hear me?
Yeah, please.
Can you see the slides? Good morning, good afternoon, everyone. On behalf of Bureau of Economic Research and Bangladesh Network for Tobacco Tax Policy, I welcome you all in this webinar. Can everyone see my slides?
Yeah, it's visible, yeah.
Bureau of Economic Research is a research and training institute in Dhaka University, which was established in 1956. Through the union-supported grant on tobacco taxation, we have developed a platform called Bangladesh Network for Tobacco Tax Policy, including the stakeholders who work on tobacco taxation and related issues, so that we can prepare a comprehensive plan for tobacco taxation and tobacco control in Bangladesh and also in the region. In my presentation, I will try to briefly talk about the current tobacco tax structure in Bangladesh and the challenges, including the structural and administrative challenges for imposing the tobacco tax policy, and whether we need a comprehensive tax policy in Bangladesh and in the region. As already Farida Appa mentioned, that the prevalence of smokeless tobacco use in Bangladesh is really high, and among the 34 high smokeless tobacco burden countries, Bangladesh ranks second after India, and 22 million adults consume tobacco, and around 25%. So 1 in every 4 adult women consume smokeless tobacco in Bangladesh. It is popular, easily available, and socially acceptable like other countries, very low price and affordable. I am struggling, so sorry. So if we look into the tax structure of smokeless tobacco, smokeless tobacco was brought under the purview of taxation in 2003. And we have ad valorem excise tax on Zarda and Gul, these two types of smokeless tobacco. Ad valorem excise tax is the type of tax which is imposed on the maximum retail price. So it is a proportion of the value of the product. The good news is in 2019, the tax base for smokeless tobacco product has been changed from tariff value to maximum retail price. And the current tax structure, you can see that the retail price is now 30 taka for Jorda for 10 gram and 15 taka for Gul for 10 gram. We have ad valorem excise tax, which is 50% supplementary duty. And also we have VAT of 50% and health development surcharge, which is 1%. Though 50% of the tobacco users in Bangladesh use smokeless tobacco product, the tax collected from the smokeless tobacco products are very low. The total tax collected in financial year 2017-18 was 11% of tax revenue in Bangladesh, which is 1% of GDP. But in this total tax collected from the tobacco products, the share of smokeless tobacco product was only 0.22%. Despite a number of smokeless tobacco manufacturers in Bangladesh, only 21 manufacturers pay tax. A number of challenges for this low tax collection for the smokeless tobacco in Bangladesh. One of the main reasons is the production in informal establishments that other presenters already mentioned, and many of these are without license. So there is no track of these manufacturers, and National Board of Revenue hardly have information about all these informal established smokeless tobacco producers. And a number of products are outside of the tax collection because these are sold unpacked, unmanufactured in the open market like Shada Pata. You can see the photos, and I'm sure the same is in India and Pakistan, where these are just sold outside in the market and not in the coverage of taxation. This diverse nature of the smokeless tobacco product make it really a challenge to bring these under tax coverage, unlike the cigarette and bidi, which is relatively easier compared to smokeless tobacco products for tax collection. And smokeless tobacco products, as I mentioned earlier, the tax base, the price is really low. And even if there is a tariff value at some point charged on that, and now the retail price and ad valorem tax, still due to this low tax base, the ultimate tax collection from smokeless tobacco products still remains very low. And the current tax structure, that is the ad valorem pattern of tax, this is one of the main reasons of tax avoidance in the country for smokeless tobacco product as well. For regulation of smokeless tobacco product, we strongly suggest government to introduce specific tax, that is for the quantity of the product or weight of the product. So we propose that in Bangladesh, specific tax should be added in addition to the current ad valorem tax, where for Jorda and Gul per pack, there should be a specified amount charged as specific tax on smokeless tobacco products. And we also propose every year government that the base price should also be increased. This year also we have proposed the same, increasing the base price and also imposing specific tax. We also believe that there are a number of other measures that needs to be taken care of if we really want to regulate smokeless tobacco product in Bangladesh and to increase the tax coverage. One of these is the role of the local government. There should be a strong role from the local government, who should prepare the list of all manufacturers and actors in the supply chain. And the local government should also be responsible to give the license to smokeless tobacco manufacturer, as I mentioned earlier, and also the previous presenters, that a large number of manufacturers remain outside the licensing process. And as there are different size of smokeless tobacco products available in the market, these really restricts imposing of many of the laws like health warning and also the ban role for the taxation. So we strongly propose that the smokeless tobacco should not be sold in the market in these variety of packaging systems. Rather, there should be at least minimum 20 grams pack, and the 5 gram and 10 gram, 15 gram sachet should not be allowed. And we should ensure that the ban roll is there and properly maintained so that the tax collection becomes easier for the National Board of Revenue. And pictorial warning is also important, and that should also include date of production, which might help us to avoid the illicit trade and some other irregularities in the smokeless tobacco production and sale in the country. And as I mentioned, the coordination between the National Board of Revenue and local government is really important. We also believe that as everyone is working in the smokeless tobacco who presented, shared different dimensions and different issues, which are directly or indirectly influencing the tobacco taxation, its structure and collection in Bangladesh and in the region. Hence, only if we every year focus only on the tax structure and the tax base, then many other dimensions remain outside the monitoring of smokeless tobacco regulation. So definitely every year with all the international partners, the simulation that we do and present with National Board of Revenue, that's very important. That should continue, and all the advocates should focus on the regular tax rate and tax base and that advocacy. In addition to that, we believe that a comprehensive tobacco tax policy is really required so that all other direct and indirect influencing factors are also included in the tobacco tax policy, including smokeless tobacco. And that includes the input tax credit that many tobacco companies are now getting the benefit of, the ban roll, illicit trade, regulation of e-cigarette, export and import of smokeless tobacco products, companies income tax, regulation of duty-free tobacco products, regulation of corporate social responsibility funding, tax on cultivation and curing, tax administration, monitoring and tracking the tobacco tax collection, and role of local government tobacco tax cell and other organizations also Ministry of Health, and the coordination across these partners. This is not easy. We are now currently having the stakeholder consultation. We had conducted a series of stakeholder consultation with Health Secretary and others within Ministry of Health, National Board of Revenue, and the tobacco control advocates who work in smokeless tobacco control and also tobacco control in Bangladesh. So this stakeholder engagement is going on. We are discussing with different groups and taking their suggestion that how we can make a comprehensive tobacco tax policy. This we really hope that the next year this will be an agenda for us to move ahead and strongly working together with all partners with this. And just to remind that our Prime Minister really correctly stated that Bangladesh needs to combat tobacco. Bangladesh needs to be smoke-free, tobacco-free by 2040. And if we really want to fulfill the dream of this highest authority in Bangladesh, we have to work together. And for achieving the sustainable development goals, we have to control smokeless tobacco as well. And for better implementation of framework convention on tobacco control, we have to work hard on regulation of smokeless tobacco. Thank you so much for your patience hearing. Over to you, Tahin Bhai.
Thank you very much, Romana, for your nice presentation. Now, if I conclude the Romana comment that is proposing for a comprehensive tobacco tax policy for all the countries. In Bangladesh, we are working on that one, and I hope that in the few months we can going to share that one. We already drafted the policy. Now we are just checking with the other policy, national policies, and we will finalize soon. Now I'd like to request the Barrister Shabim Haider Patwari, member of the Parliament, and he also the member of the Standing Committee of Ministry of Law, Justice and Parliamentary Affairs. He is the chairman of Board of Trustee, president of Tobacco Control and Research Cell, Dhaka International University. Dr. Shamim Haider Patwari is our active tobacco control advocate, who is raising his voice not only in the parliament, in the outside the parliament, nationally, internationally, and I think that everyone know him. Now floor is yours, sir.
Thank you very much. Can you just share my presentation from your part, because I can do it technologically?
Yeah. Hilal bhai, please. I'm just getting support from the Hilal bhai. Hilal bhai, can you share this presentation, please? Hilal bhai. Yeah. For all, just I would like to inform you that Dr. Meera Jiaki, he's a renowned tobacco advocate and legend for us, with us, and we also hear from her just after the Shamim Haider Patwari presentation.
Thank you very much. Thanks, Tahin Bhai, for the nice introduction, and it is exaggerated. So I'm just an activist in anti-tobacco movement for last 10 years, and we set up this tobacco control and research cell in Dhaka International University. It was a research cell. So for last 8 years, we do research on different issues, and since 2016, under the auspices of Bloomberg Initiative, we are just monitoring the implementation of pictorial warning in all 64 districts. And while conducting this monitoring and implementation activities, our information seekers and our activists, they also find out a number of new clues and information which is also connected with the tax evasion of SLT. So that's why we also prepared a policy, a draft policy for this tax evasion issue. I will focus on the one single aspect of the tax evasion and one single suggestion on SLT. So of course, if you look into the South Asian situation, SLT is always a big challenge because all the European or American scenario and the South Asian scenario is completely opposite. And so for SLT is concerned, it's always a double challenge. First, a number of SLT is not within the tax and legal reason for some regulation problem, though technically all all tobacco products should come within the tax and law regime, but there are automatically some escape routes, and there is automatically some products is outside the tax regime.
I think that the Shamim Bhai some
Can you hear
network
me?
problem. I think that his connection will lose.
Can you hear me now?
Yeah, I can hear you. Yeah,
Okay, okay. So,
yeah, we can hear you.
okay, thank you very much. So the advantage of end part speaker, one of the end part speaker is that the number of issues has already been covered. So that's the advantage for us. Can you go for next slide? Yeah, can you hear me? Can you go for the next slide?
Hilal Bhai, next slide.
Yeah. Yeah, these are all common facts, so we all know about it. The earlier speakers, panelists also mentioned that we have almost 37.8 million adult tobacco users as per GATS 2017, and out of these 37.8 million, we have 19.2 million adults who are using smoked tobacco, and 22 million adults they are using SLTs as per GATS 2017. So SLT become a constantly threatening problem for our anti-tobacco movement because the number is higher and the regulation is weaker. And this double jeopardy is really very dangerous situation. And we in 2013 Global Youth Tobacco Survey, they also conducted another research. They picked randomly 3,245 school boys and girls from 50 schools, and they also find out 4.5% of these young students, they are SLT users. They consume SLT. So in the youth level or in the children level, SLT becoming a very high risk. TCRC is conducting their monitor and implementation activities from 19 March 2016. We sent people to 64 districts and got our findings. Can you go for next slide?
Next slide, Hilal Bhai.
Next slide, please. Yes. So this you already a number of panelists show these pictures. The left one is the different types of Gul and Jorda, and you can see it is in the loose pack. You can see it's a small pack, it's a black pack, and some of them have cover, some of them have no cover, some of them have pictures, some of them have no picture. And I will show you that some of them even company name, some of them even don't have company name. But the right part is also another problem. In the right part, you can see it's a very common picture in the village hut or village bazaar. I speak about it in every meeting and conference. The right part is never been regulated in Bangladesh. So a study need to be done. How many people actually consume the right part SLT? The right part SLT is loose SLTs, loose tobacco leaves. And this is the biggest threat for our regulation because they are not covered. You can see they're not packed. You can see there is no tax regulation on these loose products. And then they're not under any regime at all. So they are in completely no law situation practically, so far as it concerned with these loose leaves. These loose tobacco leaves is a real problem in the village areas. And I personally going to suggest in the parliament, it should be banned, though it is in the law, it should be banned that no tobacco product should be sold without any packing and without tax regimes. Can you go for next slide? Yeah, can you go for next slide?
Next slide, Hilal Bhai, next slide.
Yes. So these are some historical dates on SLT, so they're not so important. I can go to the third line from the bottom, and it says the strategic plan for surveillance and prevention of non-communicable disease in Bangladesh, 2017 to 2010. There is a reference of control of SLT. This is so important. Then in our fifth yearly plan, 2016 to 2020, the government also emphasize on control on SLT. And SLT also, the National Tobacco, and we also presented a paper on smokeless tobacco control. We also suggested a standard size for SLT, and through Ministry of Health, we send it to the relevant ministry, because if it is not a standard size, you cannot really fix the pictorial warning, or you cannot make the pictorial warning really truly effective for the purpose. Will be frustrated. So we also suggested a size. And if you look at the revenue collection, I have a data from 2017 and 2018 tax collection, tax year. There, from Jordan, we collected revenue of 470.1 million. 470 from 1 million, and from GUL, we collected only 16.4 million. So you can see the consumer or of SLT is higher than regular tobacco or smoked tobacco, but the tax collection is very, very insignificant, very trivial, very low. And because of the evasion escape, and also a number of product is outside the tax base, that is the real problem. And also, if you could look at our tax structure, only Jordan GUL is mentioned there in the tax policy or in the budget session. No other SLT product is referred there. This is also another problem. There should be a clause of other tobacco products. Then we can really impose the regulation. Can you go for next slide? Yes, so the research I'm talking about, we have three objectives initially. We wanted to implement the graphic health warning on all tobacco products, including SLT. We also try to identify how tax evasion was done in SLT product, and what is the modus, and how NBR is doing the wrong in collecting tax in SLT products, and also to measure the importance of a standard packaging or model for effective implementation. As I told already, we have submitted a standard model for SLT product to the Ministry of Health, and the government is working on it, I think. Can you go for next slide? So this is just a research methodology, and it is 1, 2, and 3 chart. So can you go next slide? Yeah. So our team sends data collectors to 64 districts. They're mostly our Dhaka International University students. The students are really encouraged to do, and this is where we also create anti-tobacco activists. They go there, they collect data, we educate them, and we make them advocates, basically. This way, we really creating hundreds of anti-tobacco activities every year through this research and everything. So we send students with senior students to 8 divisions and 64 districts, and that means the whole Bangladesh. But we only sent 64 sub-districts, though we have 540 sub-districts. But so far as district level, we covered whole Bangladesh. And the study period was for 24 months, September 2017 up to August 2019. And of course, the research was done under the direct supervision of TCRC.
Can you hear us? Okay. Hello.
Do you hear me?
Yeah. Yes.
Okay. If you can't hear a slide, just I can repeat that. No problem. Yeah. Just let me know that. Yeah. Okay. Thank you very much. So what our team find out in 64 district, they surveyed, visited, monitored 265 big wholesale market area for SLT and tobacco products. So they find out, they go inside the whole bazaar and inside the big markets and find out the wholesale market. And they visited 265 wholesale market. They got lots of findings on the wholesale market and wholesale packaging. I'll tell that about some other time. And they find out 788 smokeless tobacco brands is now at the moment, they find out in Bangladesh. The number will be, of course, higher than that, but they find out 788. This is so important. 788 in a country, in one country. and they found total brand of Jorda 730, and total brands of Gul is 58. So this is TCRC finding, and if you go to the NBR or others findings, you will see the number is very less there. So what they basically find out, it's so important that out of these brands and out of these companies, they found out in the second line 676 Jorda brands, they have factory name, just the factory name, not proper address always.
Hello.
They didn't find the name or address. So you have tobacco products, Jorda and Gul, without any name and so they wrap it in a foreign name or foreign language, so that the tax inspectors, if find it, they will believe it comes from other country, it is not produced in country. That's the way they also keeping a good number of product outside the tax regime. So yeah, they thought it is smiled, but which is not. So this is also another problem. This foreign packing is not technically coming from India, but they packed it like India. Sometimes they packed it like with a mosque picture. Sometimes they packed it with a praying man's picture. So that creating a impression of religious nature with this Jorda and Gul. So the problem, why there is so many brands, and actually there is not so many persons behind these so many brands. There are few persons, few factories, few companies, few groups who are doing this so many brands. So when they produce Jorda and Gul, they produce it in a different brands, so that NBR can find out some brands and tax them, and at the same time a good number of brands is always remain outside the tax regime. We also find out they just open temporary factories, do the business and production for 3-4 months, and then shut it down because it's hugely profitable. So the profit they make, in these 3 months, that's enough for them. So this, because it's so easy to produce Gul and Jorda in an unscientific manner, so that's why they do it. And the profit rate is very high if you evade the tax. So can you go for next slide?
Next slide, everyone. Everyone, next slide.
Next slide. Can
Hello.
you hear me?
Yeah, now, yeah, you can hear me.
We find out 6 major. Unmute. So it's
No, yeah,
can you hear me? Yeah.
please.
Okay. So it's basically the problem is it's Jorda, Gul, and other tobacco products is home-based factory. Production in one area, sell in another area, having multiple products with the same name, and tobacco companies doesn't mention the address, and no list of unregistered company. We don't have a comprehensive nationwide single database or list for Gul and Jorda company or other SLT product company. There is no national listing. There is no mandatory requirement of national listing before you start production. So the thing is happening, I think, they produce it, then sometimes they give some tax, or there is no ban roll. That is the problem. So we need a national requirement of prior approval or prior listing or prior registration of SLT production companies. That is important. And the effect you can see, you all know, There is a drastic fall in the collection of revenue. It's hugely profitable. It's hugely unmanageable. They're making home-based factory, and companies and factories are operating without registration, and rapid relocation of factories because they are not regulated. So they just change the factories every 3-4 months or 6 months. The company can't easily identify because of the lacking of name and address. That's the problem. Having on proper and speedy. Okay, no problem. I can read this. So these are the problems and effects we find out. Can you go next slide? So with a huge number of suggestions that already Professor Rumana and Farida Appa already suggested, and some others, but we want to suggest something new, a new edition, that the tax collection or tax inspectors, so far they only register or go and visit the factories. So the blue part, they usually collect tax, the blue part. But we suggest no, not from blue part. You should collect tax from this green part. So you should also go to the wholesale market. You'll find a pile of bull, Jordan, other products there. You find them whether they are taxed or not, and then tax also from the wholesaler. So that when the wholesaler they sell those products, they give tax to the government. So they are also responsible for the tax, because in almost 50 or 60% cases you can't find out the factory. So there is a escape route. When you go to the wholesaler, they show you the factory. When you go to the factory, you can't find the factory. So this is our current tax collection system. It's just a layman's approach we have taken here. So NBR go to the factory and collect revenue. NBR don't go to any other segments. Next slide, please. I think I'm running out of time. So this is our suggestion, that NBR should go to the market area, as we have identified 265.
Shamim bhai, I think that your connection again. Hello, can you hear us?
Hello.
Hello.
Yeah, I can hear. Yeah. Okay. Yeah. So all we're suggesting a simple approach to raise the revenue and make the SLD business less profitable. The NBR should also include the wholesale market in their tax collection regime. So it should be mandatory whenever the wholesale dealer or wholesale shop owners, he will sell it with tax. So he will be responsible also for tax, not only the factory, because as I told, the factory we cannot find out or cannot locate always. Next slide, please. Yeah, next slide. So we just make some quick three recommendation, 1 to 3. That is, all smokeless tobacco companies must register, create portal, and announce a public notice for registering under certain period of time. So NBR or NTCC should announce a public notice. You listed all the SLT factories within 1 month or 2 months. If you don't list within 1 month or 2 months, you'll be shut down, something like that. We need a national list. Secondly, make a list of the smokeless wholesale stores. As I told, factories is not covering the whole tax regime. The wholesale stores is also need to be covered. And number 3, not only inspect the factories, also inspect the wholesale stores and confiscate and destruct unregistered or unlicensed or tax escaped smokeless product. Often we should also do the mobile code. We have done one mobile code to the wholesale stores and confiscate and give them an exemplary. So our researchers, they make a comment on smokeless tobacco. I like to read that out. Smokeless tobacco products manufacturers are difficult to find, but the market for this product is well organized and precise. So it is possible to impose tax evasion and implement graphic health warning only if monitoring is strengthened on the market system. We have to enter the tax system into the market system. Can you go to the next slide?
Next slide, please. Yeah, please.
Yeah, so I told you, yeah, I'm almost done. So all that I say that we have to do the mandatory standard packaging for all SLT. We have to introduce the tax ban rule. Professor Ruman already suggests that. We need compulsory registration for all tobacco companies and inspection the wholesale shop. That is so important also. And also we should include the local government for licensing and monitoring also. Next slide.
Next, Hilul bhai.
Next slide. So this is
Thank
our finding, and union adopted that. We find out hundreds of Jorda Ulgun factory who are not listed in NBR. And after our movement, NBR did make a provisional list and working on the list. And this is one of the biggest finding of TCRC and other partners organization for tax evasion by Jorda and Gul factories. And it was reported in our local newspaper as well as in our international media, also in electronic media, Jamuna TV, you can see. Next slide, please. So this is our suggested path for tax-free tobacco products. We invite comments from all the tax experts. So how we can crystallize that to include the wholesale market monitoring as a imposing tax regime on all SLT products. And I thanks Tahin Bhai and the union and all the partners for arranging such a wonderful event on SLT control, which is a big challenge for Bangladesh, of course. And I was really enriched by others' presentations, in particular from the neighboring countries, and we can refer them. We can really learn from them. It's a wonderful platform. Thank you, everybody.
Thank you very much, Shamim bhai, for your nice presentation and really a good thought for that one. We have really successfully identified that market-based monitoring can be a solution for the tax evasion. As the all presenters share that one, the India, Bangladesh, Nepal, Indonesia, we are similar problems. The tracking the factories is one of the challenging things, but the tax department is trying hard to find the factories. But now, as we have find out that in Bangladesh, there is a very good market change in Bangladesh for the ST, and this can be a good tools to extended the tax network. I think that we can share with these things with the other countries. Before I conclude, there is the Miraji Aki is there. I don't know. I try to. Miraji, can you hear us? We love to hear from you. And Judith Mekai was there. She appreciated that. Roberto is there. She also said that it's a good thing. And from the union, our tobacco control department, Ashish Bhai is there. I would like to request two things. As the Shridapar is one very important thing, Ashish Bhai, that we have to be work together. And Miraji also is there. So my conclude before conclude the webinar, my suggestion is that if that we can establish a working group or a mechanism that we can follow up among the South Asian countries, because we are the high burden area in the world, to work on the SLT, to follow up some policies, to jointly do something. So this is my request to you, and Miraji also there. So Miraji, already you are there. If you can say something for us, we'll be really happy. Then Ashish Bhai is there. Miraji, please.
I'm really sorry I got mixed up with the time. I thought 4:30 was daily time. So even though I came a bit earlier, but I was late. So I missed, the some of the presentations. I wanted Farida's presentation so much, and I wanted Ashish's presentation. I hope I can get it from them. But I think that, the dynamism of Bangladesh is much to reckon with. I think that we have heard such excellent presentations, and I think that throughout I have seen, and also from all the notifications that I get from Bangladesh, I think that you would like your government to take a very active role in sort of controlling the tobacco industry. And also, I have seen that, whenever you introduce some regulation or some notification, the next day it is all gone. I've seen Farida doing so much and getting frustrated that the next day you find out that everything is undone. So I think that it has to be, you all have to work together. And I think you need also support from the rest of South Asia. And I think that India would be so happy to lend its support. And of course, many of you are working with the union, and we are there to support you. But I think that from whatever I heard, I thought it was an excellent deliberation. Thank you very much for inviting me, and I'm very happy to be here.
Thank you very much, Miraji. Thank you very much to being with us. Thank you
Can
very
I
much.
see Sir John? I haven't seen him. Where is he?
I think that he also there. Mr. Shujon, are you there? That you can raise your hand. Shujon also there. He is working for the NTPC now. He's there. So
my camera is actually not working.
There he
Sorry,
is. There he is.
but Miraji, I can see all.
Put your
And
camera on.
yeah, my camera is not working.
okay. So now I would like to request Ashish Bhai, if there is we can after the conclusion, there are two things. One recommendation come from you that we can, if the ban the smoke acid use in the public place, it's really good decision, and we are start working with the local government, our organization Gram Bangla, and the AI Aid Foundation. They are working with the local government. Local government has the provision to ban this one in the middle, in the metropolitan city already. Our Barrister Shamim Hadar Patwari write a letter to the IGP to ban the sitting in the public place, and as well also the use of SLT. So my request is that how we can work together from the union side, if you can say that one, this is the common problem all over the country. So if there is any suggestion from your side.
Thanks, all the presenter. It's a excellent webinar, and the very enlightening information that I have received, especially from Bangladesh. Excellent research done by TCRC. The Patwari sir shared it very nicely. Mr. Mana, of course, he has been a resource when we talk about taxation, and Farida Appa, immense experience that I would say that we can get benefit. So what I would suggest here is that, you see, if the first is as a first step, even if we can collate all the recommendation came from this webinar, and let's start with that, and maybe we can start with that and share with the presenter and few other eminent experts which are presented in this group, in this webinar. So that could be a one starting point, and if that group agrees, we can definitely continue work as a working group to develop some policy or a strategy note, or maybe a roadmap how to go forward on this issue. We can definitely learn a lot from each other's experience, from India to Pakistan, from Nepal, Myanmar. So this is very very concentrated problem in this region, and this is not really but because I interact with at many fellow on this issue recently, when India has done immense work on smokeless tobacco regulation. It's still not really trigger much of the tobacco control expert around the globe. because they don't see this as a problem, as a global problem. This is more or a regional problem. So that's a very excellent idea. Tahin Bhai has shared that we can come up as a number one, as a working group, and we can learn from each other and develop maybe a strategy note or a roadmap how to go forward about that. Yeah, I support that idea.
May I? May I? I
Yeah,
think
thank you very
that
much.
I
Yeah,
think
please,
that
please.
Farida's work is exemplary. I mean, we got to learn from her work because she has, of all the countries in the region, she is, I think she stands out in her work with the women and how she has empowered all this women's group. And this women's group, I think, should be also very responsible in this group that we are talking about, who can take a lead to do things. Because I think the rest of the countries do not really spot out and mention about the women so much as she does. And I think it's a constant remember that she sends to us, the role that women can play, the leadership role that women can play in this. And I think she's a true leader of women.
Thank you, Miraji. This is a nice comment. So I would like to the webinar. In this webinar, there's a participant from India, Bangladesh, Pakistan, Nepal, Philippines, Indonesia. So many countries join, including Bangladesh. I would like to thank BR, TCRC, and our BNTTP and Tabinas to organize support background. So many things they do. I also thank the Bangladesh Indian Tobacco Alliance. They have always the secretariat support us organize that one. Our all the team members they work hard last few days to mobilize support and all the things. Thanks to our secretariat, BN, TTP, and of course the presenter and the participant who was there. Thank you very much. Hope that we will come soon with the recommendation all of you. Thank you, Shamim Bhai, to be with us. Not only a
Thank
tobacco
you.
control advocate, you also a parliament member, and hope that next parliament session you raise this issue. Thank you very much to all of you. Again, thank you. See you again. Stay home. Stay safe. Bye.
Thank you very
Thank
much.
you
Thank
very
you.
much.
Thank you,
Thank you.
everyone.
Thank you very much.
Hmm.